Hi everyone, welcome to Tom's Manshed. Okay, a totally different video from me this time, not a review at all, as you can tell from the title of the thumbnail. All this is me just sat in front of the camera here with a beginning to end of the treatment I received and the diagnosis and everything of when I started peeing blood last year. Now, it's only going to be of interest to anybody experiencing the same thing, and the main purpose I'm doing it for is to say, go and see a doctor, a walk-in centre or whatever, but get something done. Do not ignore it, even if the symptoms just disappear the day after like they did with me. Do something about it. There's plenty of cases. A lovely newsreader guy called Bill Turnbull here in the UK recently died of prostate cancer, and he didn't do anything. He was experiencing pains and things and put it off and put it off and put it off before seeing his GP, and he regretted doing that. Who knows, if it had gone earlier, might have been a better outcome. We don't know, but that's the sort of incentive to get something done. And it's not always bad news. If you just want to skip to the end and see how it turned out, skip to the end. But I'm hoping if you're experiencing a similar thing, or have experienced a similar thing, that just this run through of everything that happened to me, and I can't be a unique case, might apply to you, and it's not always terrible news. So you'll have to excuse me if there's lots of jerks in this video of editing, because there's going to be things I forgot, things that happened that I've added in later or whatever, and I'm reading a lot of it off. I kept sort of like a diary, if you will. There's a lot of dates, a lot of names of drugs and things like that, and times and procedures. So a bit of the time I'm going to be sort of like looking down here at my book, so I haven't got an auto cue, so I'll excuse that. Right, okay, without further ado, this is what happened. So, Friday the 3rd of September. Today is the 21st of September, so it's just over a year ago this started, a year and 2 weeks. And I remember it vividly. We'd come back, me and my wife and my granddaughter. We used to look after her every Friday. We had the same routine. We used to go and pick her up in Fleetwood, go shopping round Aldi, come home, and she used to have a sleepover at our house. And this was Friday the 3rd of September, and about 6 o'clock, once I'd got home, I went for a wee. No symptoms or anything before, just everything was normal. And I'm having this wee, and it comes out with like a burning. It was burning as it was coming out, and it was like black currant juice. Now, I've attempted to, don't worry, this isn't it. I've attempted to do something the same colour, and I've put the same sort of amount of a black currant in this thing, and to get it the colour, and that's the colour it was. So you can see a distinct red sort of tint to it. And also there was loads of little tiny bits in it. As I sort of looked down, you could see little black, they look like black spots, or tiny blood clots in it. So I thought immediately, worried. You see blood in your wee, you're worried. Told the wife, she says, right, get something done, ring up the doctors tomorrow. During the night, I went a bit more often than normal, and when I did, it burnt again, and it was still that colour, but it was gradually getting better. Following morning, when I went, tiny bit left, and by sort of like a bit later than that, it almost cleared up. So I rung the walk-in centre. There's a walk-in centre about 5 miles from me on Saturday the 4th. It's the following day, and they said, right, get straight down here. They examined me, felt all over my stomach. Does this hurt? Does that hurt? No. Asked for a wee sample. It was pretty clear by this time, and she said, oh, it's probably just an infection, a UTI, urinary tract infection. And what I say, I went to Walk Centre Fleetwood, and she gave me a 6-day course of macrobid. I'll put the name of the antibiotics because a couple of them changed throughout the treatment. And so a 6-day course of macrobid antibiotics. and the infection cleared up. It went absolutely clear. The wee was crystal clear, it was the right colour and everything, and the pain, the burning sensation had gone and everything. So the course finished on Thursday the 9th of September. But by Saturday, a couple of days later, the cloudiness had come back. It had gone a bit sort of cloudy during the weeing and that, and after, even though the blood had sort of faded, it was still cloudy. The antibiotics made it crystal clear. As soon as the antibiotics finished, a couple of days later, it was cloudy again, and the burning sensation again. So I rang the doctor, I rang my GP. I went in on Wednesday the 15th of September. Again, all the dates are on the bottom here, just to show you. I was getting very quick treatment. As soon as I rang out, I was in there. And she gave me a rectal prostate examination. Now, as you probably know, if you've got prostate trouble or suspected, they stick a finger up your bum and feel for an enlarged prostate. Now, it's okay when you've never had it done. I was like 62, never had this done in my life. Very embarrassing, I thought, at the time. But it had to be done, so I had it done. It's absolutely nothing to worry about. It takes a few seconds, a little less, about a minute maximum, and you just lie down there on your side. The doctor puts his or her finger at your bum, feels around. It's just a daily job to them. And by the end of this year's treatment, I'd lost all embarrassment, of front, back, whatever. I just didn't care. I just wanted it sorted. And trust me, you're not embarrassed by the end of this treatment. So she gave me this prostate examination. She said it was all right. It's a tiny bit enlarged, she reckoned, but nothing to worry about. And gave me a new 5-day course of a different antibiotic called amoxiclav, and prescribed an appointment with the urologist and to get a CT scan. So I went on this 5-day course of amoxiclav, and sure enough, as soon as that finished, it went cloudy again. During the 5-day course, the cloudiness cleared up, it went crystal clear. As soon as it finished, day after it finished, cloudy again, and slight sort of burning sensations. Not as bad as before, but it was cloudy, very, very cloudy. Now, cloudy urine isn't anything to be alarmed about normally. If it's only like a couple of weeks or a day or something, it can be due to dehydration or other things. But if it stays cloudy again, go and see a doctor. Throughout this video, I'm going to keep saying go and see somebody about it. That's the main message. Don't ignore it, even if the symptoms disappear. If they've been there, go and see a doctor just to be sure. So she gave me this amoxiclav antibiotics, booked this appointment with the urologist, and a CT scan was booked. So on Wednesday the 22nd of September, I went to the urologist for a thing called a flexible cystoscopy. Now what this is they put a probe down the end of your penis, put a numbing gel on first. Again, all embarrassment, forget about it. You have this so often, or I had it so often that it was like second nature. But they put this probe down, and there's no anaesthetic on it, just local anaesthetic gel, and they could sort of move this probe round into your bladder, and it appears on screen, and you can have a look. It's not like a full operating theatre, this, but you're lying down, and there's a couple of nurses with masks on and everything, and you can see on the screen what the doctor is seeing. So like I said, I went in on the 22nd, Wednesday the 22nd for this, but he couldn't do it because the urine was still infected and cloudy. So he prescribed a 7-day course of trimethoprim. Sorry if I can't say these properly, but again, I'm putting them underneath antibiotics. And a new appointment for a week's time. So the infection should be clear, because I was still sort of on the biotics a week later. It was the last day, for next Wednesday. He said that if he'd have done that cystoscopy today, there could have been a risk of sepsis while I've got the infection. So obviously we didn't want that. So 7-day course of this different antibiotics and go back. So Saturday the 25th of September, this is 3 days after that appointment, I had the CT scan. So I had to go to Blackpool Victoria Hospital, which is where all this happened, to the CT scanner. They don't tell you any of the results. It just goes straight to the doctor, who checks it at your next appointment. Now, if you've never had a CT scan, it's absolutely nothing to be worried about. I've had one before for some trouble I had with my ankle. But some people do get claustrophobic, and if you don't know what a CT scan is, you just basically lie on a bed and it motors you into this big, huge magnet, basically, which takes unbelievably accurate pictures of the insides of you, much, much more detailed than an X-ray. And it's just amazing the pictures they can get. So they do this to see if you've any prostate trouble, kidney trouble and stuff like that. But it doesn't worry me at all. But I know it does worry some people with claustrophobia. But again, there's nothing to worry about. It just wheels you in. You're just there for a few. She puts something in your vein, some sort of indicator liquid, I don't know what it is, and that works its way around your urinary system and shows up any problems. And once that CT is taken, like I said, they don't tell you anything there. The operative taken it, even though they can probably have a look at things and see any problems, but they don't tell you, and that just goes straight through to your doctor, who you see at the next appointment. So Wednesday the 29th of September, this is a week after he gave me the antibiotics, I returned to have the cystoscopy. This time the infection had cleared, like I say, because I was actually still on them. That was the last day. It's only after he'd been off them a day that the infection tended to come back. So they did the cystoscopy. Again, absolutely nothing to worry about. It's totally painless. You know even what's going on, and it's quite fascinating seeing the screen next to you. And he's moving it all around, and he came across a red spot. And again, he says, "Oh, it's not too bad, but you know, it's there. So we'll take a look at that." They tested the urine flow, and it was slow and hesitant. Again, I'd sort of put this down to just getting older. It's not as fast as it always was, and it's sort of like tending to spurt a bit and take a bit longer. But what they do, they get you to wee into a toilet with like a funnel in the bottom, and in this funnel there must be some sort of impeller or whatever. Even though you can't see it, you can see straight down. I don't know how it works, but it measures your urine flow. And they get a little printout, and the nurse who took it said, yeah, when you're young, obviously, it gushes out like a fire hose. It would have been right up. As you get older, it tends to sort of like go down and slow. And they're very keen on all your visits after that, testing this flow to make sure it's consistent and of a decent speed. So because it was hesitant and slow, he gave me a 1-month prescription of tamsulosin, and that's designed to shrink your prostate, because you should probably know your urethra, the bit the urine comes down from your bladder, goes through your prostate gland. And if your prostate swells up, as it can in later life of guys, there's only guys have a prostate, by the way, it can swell up and it can restrict, like squeezing the pipe, so restricting your urine flow. So this tamsulosin is designed to reduce the swelling or reduce the size of your prostate, so it's not restricting the flow of your urethra for your urine. I know I'm a bit hesitant and all that with these technical terms, and forgive me if I get anything slightly wrong, but the basic details are there, and then, like I said, this is just what happened to me. So he did that, and he gave me a new appointment made for a 1 month's time, plus a blood test for 2 days before that, to check regarding this red spot. So, on Monday the 25th of October, I had the blood test at Fleetwood Walk-in Centre again. And then on the Thursday the 28th of October, I had a second flexible cystoscopy to see if this red spot had got worse or stayed the same or gone or whatever. Different doctor did the examination this time, and unfortunately I could hardly understand a word he said, a very muffled voice and poor English, and but I got to know from the nurse that the red spot hadn't changed. It hadn't got any bigger, but it hadn't got any smaller either. So he said that the first doctor, Dr. Ismail, would be happier if I had a biopsy, that's done with a rigid cystoscopy. So here's a picture of a rigid cystoscopy, and as you can see, it looks horribly painful. The size of it going in, but again, this is done under a general anaesthetic, and you can't feel a thing. So he booked me in for one of them, and I also had to tell him that I was nearly out of these prostate pills and get him to prescribe more, because they'd only give me 1 month and no mention of it after that. So it comes the Saturday the 16th of November, and you go in for your pre-op. Now your pre-op is you sit and talk to a nurse, and she goes through, and it's quite a long sort of like loads and loads of forms they fill in. She goes through a full talk explaining the whole procedure, what they do, asking for, am I allergic to the anaesthetic and this, that and the other, and explaining that I need to have a COVID test and isolate for 3 days before the operation. So this was during like the sort of peak of COVID. So I had to go and get a COVID test done. That was negative, and isolate 3 days, be totally at home, no visitors or anything before the operation. So Friday the 12th of November, I had the COVID test at the drive-in facility at Blackpool, Victoria, and then I had to isolate for 3 days. Monday the 15th of November, I goes in for this rigid cystoscopy. Now, the appointment was for 6:45 a.m. They hope to get you in and out in 1 day, but it was a very, very long day due to having an emergency. Somebody with an emergency had to sort of jump the queue, which is totally understandable. She comes along saying, "I'm very sorry, Mr. Ross, but we're now not going to be able to even start seeing you till about 11 o'clock. So I had to sit there till 11 o'clock. Then they go through all sorts of things. First of all, they put you have a discussion with the doctor and the anaesthetist, and the anaesthetist says, you've two choices. Do you want a general anaesthetic, which will like knock you out, and then you'll come round after this biopsy procedure and be sent to a recovery room and you'll feel a bit groggy and blah blah blah, or do you want an injection in your spine, like a lumbar injection that numbs everything from the waist down, so you're conscious during the procedure? So I said to him, well, which do you recommend, which is best, which has the quickest recovery time? Because I was eager, Monday night is my quiz night, and I was eager to get out of the hospital and to the quiz. Now, I'm not diminishing the seriousness of the situation at all. If I was in hospital overnight, I was in hospital overnight, but I'd have loved to have got out and got to me quiz as normal. So I asked him, and he says, well, the quickest recovery time is from the lumbar injection, because you're not feeling groggy, you're not coming out of sleep or whatever. So I went for that one. I plumped for that one. So they then put you in a room waiting. They take all your clothes off, put a gown on you. They don't take clothes off, you take clothes off. Put a gown on you that fastens from the back, so they've got easy access and everything. And they put these compression tights on you. So here's a picture of me in the room with these tights on, looking very sexy. So yeah. And so I was in there for ages. Oh God, it seemed don't know, well over an hour just sat there waiting. So they finally come for you and they wheel you into this operating theatre, and it's like the full operating theatre with all the lights. There seem to be about at least 6 people around, the 2 doctors doing the operation, the nurses, the anaesthetist and everything. Set you on the edge of the bed, give you this injection in your spine, tests if it's working and that, wheels you in, gets done. So like I say, you're totally conscious during this biopsy, and what they're doing, they're taking a chunk, in my case, of this red spot to test if it's cancerous or whatever. So you're totally conscious during the procedure, cannot feel a thing, surrounded by all these nurses and doctors. This time you can't see the screen. There's only the doctors can see it, so it would have been quite interesting to actually see them nibbling at it. And what the biopsy is, as you probably know, just taking a sample of this red spot, and then they seal it up with a heat, like a laser or whatever they used to seal it after. And he did find a further 2. On further examination, he found 3 of these red spots in there on the wall of the bladder. And so he took biopsies of all of them. And this procedure took about 45 minutes. He then withdraws the camera and the tool that has taken the biopsies. And I could hear the 2 doctors having a discussion, and they said that they're going to put a catheter in. I forgot to say earlier on, but they did explain sometimes you have to have a catheter put in. They make the decision there and then whether to do it or not. In my case, they did put one in. So here's some pictures of a catheter. It goes up your willy into the bladder, and there's a little bulb. You can probably see it there on this picture. That bulb expanded. They sort of pump that bulb up, and that seals the throat of where it comes out of the bladder. And that catheter then goes into a leg bag, which is attached, as the name suggests, to your leg. So they put this in, and they explained that it'll be about 3 days in there. They then wheel you into a recovery area. It's just sort of like an area outside the operating theatre where a nurse comes along and just keeps monitoring you every few minutes, every 10 minutes or so. She was taking readings, I don't know, forget now, temperature, heart rate, whatever, asking if you're all right. And I was feeling fine, and slight sort of tingling appearing in me feet as the anaesthetic wore off, like pins and needles. She said it was quite normal. So they wheel you from then the recovery area where they're constantly monitoring you. They wheel you into a recovery ward. And this is just a conventional hospital ward. It had 3 guys in it who were all undergoing similar treatment to me. And this catheter is connected up to a big bag. It's like an overnight bag, if you will, that your urine trickles into, and that's on the floor beside your bed. Now, they keep coming and checking up, but not quite as often. So I was in there hoping that I'm going to get out in time for the pub. They called me, ask you for, in my case, they asked, do you want a tea or coffee? I said, coffee. They brought me the coffee. Do you want sugar? Yes. Brought me the coffee, had sugar in, it was absolutely stone cold. So he came along, he says, something wrong with that? I says, yeah, it's stone cold. Oh, do you want another one? I said, I'll have a tea this time. So he brought me tea, red hot tea, this time with no sugar in it. Eventually I got the right one. That was in this recovery ward, looking at me watch, hoping that I can sort of get out in time. Nurse comes along and goes through the catheter procedure with you. Now they put a leg, just before you go out, they put a leg bag on you. Now this is, unfortunately, I can't show you the leg bag because it just got thrown away, obviously. Here's a picture of the leg bag, and as you can see, the catheter just goes into that leg bag there, and that is strapped to your leg. Now, it's weird. Sometimes you can feel yourself weeing. You just sat there and you can feel it trickling out into this bag. Sometimes you're not aware that it's doing it, that you're actually urinating. So you've got to keep an eye on this leg bag because it doesn't hold that much, really. So you don't want it to sort of like overfill and start leaking out and big damp patch on your leg. That should be quite embarrassing. So, like I say, it's not like normally you're bursting for a wee, you know you want the wee, and then you go to the toilet. Like I say, in this case, you could be weeing and not even be aware of it. So you've got to sort of like go to the toilet and have a look. And there's a little tap on the bottom, just like a normal sort of ball valve on fish tank stuff, aquarium stuff, petrol tap or whatever. And you just basically dangle your leg over the toilet, undo this thing, the urine runs out, and you tighten it up. Okay, so I'm inserting this bit now, recording a bit later because I finally found it. Been looking all over for this. I knew I'd kept this. This is your night bag for the catheter drains into. It'd fallen behind my subwoofer in the shed here. So yeah, so when you wake up in the recovery area and then the recovery ward, this is the only bag you've got on. They attach the leg bag later on before they let you out of the hospital. So this attaches to the catheter and it drains into this, and this goes on the floor. So it's I washed it. It looks a bit sort of stained there, but I did wash it immediately after use, and it's been there ever since. And it holds 2 litres. So it holds a hell of a. Once it's full, it's quite heavy to lift up this. And this end, like I say, connects to your catheter. So this lies on the floor when you're in the recovery ward and that, waiting for your leg bag to be added. And what happens is, once they've come and fitted your leg bag, which only holds, as previously mentioned, that tiny amount, on the bottom of that there is a little tap. So that's the one you use when you're out and about. Now, I made it for the quiz. The quiz starts at 8 o'clock. I made it with minutes to spare. Managed to get down to the quiz. As I'm coming out of the hospital, she says, try and drink as much water as you can. I says, well, beer is 99% water. Am I okay having a couple of pints of beer? She says, yeah, of course you are tonight, but nothing in excess. I was absolutely gagging because you go into the hospital for this procedure, you've got to fast for hours beforehand, and you're not allowed anything to drink all before. So the whole morning, I was there at 6:45. I didn't get the operation till 3 o'clock. You're not allowed any water or anything, so you come out of it absolutely gagging. So managed to get to the quiz, and I think we won it as well, so that was good. And walked in, all sort of like as if I'd wet myself or whatever, with the catheter under my jeans. I should have taken some slacks. My advice is, if you're going in to have this done, take some like jogging trousers or something very lightweight and flexible that'll go over. I had denim jeans on, and trying to get them over your leg bag and your catheter isn't that easy, but managed to get to the pub. So during, like I say, when you sat there in the pub or at home or whatever, you fill in your leg bag and you're not always aware, so keep checking in the toilet and drain it out, as I've just mentioned. But then when you go to bed at night, the drain valve at the bottom of your leg bag, you leave that open and you attach this tube to that. So it drains straight through your leg bag into this one, and then again on the bottom of this you've got a drain valve. Not a quarter turn one this time, but it's a spring-loaded one. You just push it like that and it opens up. So in the morning you would take this to the toilet, drain it all in there, and then reconnect it to your leg bag if you're staying at home. You can carry this around or whatever. If you want to go out, disconnect this and you've got your leg bag, which holds that limited amount. So basically that's it. Really tough plastic, no chance of any bursts. So I don't know whether I'll ever find a use for that, but that is your overnight bag. Like I said, I can't show you an example of the leg bag. Oh, and by the way, I forgot to say that when you've got your catheter on and you've come out of that first day of the biopsy, they ask you to be not alone at home that night. Now, unfortunately, my wife had died during all this procedure on the 17th of September. It was the worst year ever in my life. So I had to stay with my daughter that night. So that's just zooming back again. She kept her eye on me and I stayed at her house that night. So on the 19th of November, I went back to have the catheter removed. Now, I thought that would be just a quick get it removed and out, but no, I was there for 3.5 hours, and that wasn't waiting, that was everything's done. It pulls out dead easy. She just deflates a little valve, that inflatable balloon sort of thing that she pumps up with the air thing, deflates, and she just pulls it out. No anaesthetic or nothing. That's it, done away with, catheter free. But they're then very, very keen to do a flow test again and make sure you're not retaining any urine in your bladder. So they give you an ultrasound test. I forgot to say earlier on one of my other appointments, they gave me an ultrasound test as well. And they want to make sure that you are evacuating all your bladder. And the ultrasound showed that I was still retaining some urine in my bladder. I still had 150 millilitres left after I'd finished weeing. So she then asks you to do a double void test. So you sit around 20 minutes and she asks you to go again, and even though you don't feel like you want to wee, she asks you to have another wee. I couldn't at all. She says, "Are you sure?" I says, "Yeah, I can't. Nothing is wanting to come out at all." So she then sort of sent me away, go and have a coffee. So I went to the restaurant, had another coffee. There's a water machine in there. Sometimes they ask you to drink loads of water. They ask you to arrive with a full bladder sometimes and all that, so they can do that. So I went and had a coffee, hung around another 20 minutes, then did the flow test and that. And it was quite a good flow this time. And she tested my bladder, and this time there was 75 millilitres left in the bladder, and she said that's fine, it's near enough empty. So she allowed me home. So a week goes by. Like I say, 19th of November was when I had the catheter removed. A week goes by, 26th of November, and it still hurt when I was peeing. The burning sensation seemed to have got worse. There was no blood, but that night when I peed, a single blood clot came out, a much bigger blood clot than the little tiny ones when this all first started. The urine itself was normal colour, but a blood clot came out. Now, straight after the biopsy, it's normal to have some blood in your urine because you have had an operation, pieces of your bladder removed for the biopsy, so it bleeds. So it's quite normal, and there was some blood in, but that settled down. But this was a week later, and even though there was no, it wasn't this colour or anything, it was normal colour, there was this quite a big, I would say like half the size of a pea blood clot in there. So again, I'm sort of quite alarmed, so I went back to see the doctor, and saw the doctor, and they said that it was, this is quite normal after, because there's some blood clots form after this biopsy, and it was one of these coming out. There was no actual bleeding in the urine. They told me the results of the biopsy. Now this is 11 days after the biopsy. You would think that the hospital themselves would ring up and say, "Oh, hello, Mr. Ross, it's hospital. We've had the results of your biopsy back. It's clear, or it's whatever," but I hadn't heard anything. The doctor said, "Oh, I've got some good news. The biopsy was benign. It wasn't cancer. It was benign, so nothing to worry about." So I thought, well, that's great, but I've been wondering, worried for 11 days here. It'd have been nice to know a bit earlier on. They told the GP, but didn't tell me. But so anyway, so I went through this, and I was given a 7-day course of ciprofloxacin. Yeah, ciprofloxacin. Probably pronounced it wrong again, but again, I'll put it down below. Antibiotics. And he said hopefully it was just a post biopsy infection, post-op infection, and the CT scan was fine as well. A tiny bit of scarring on the kidneys, but again, nothing to worry about. So, Monday the 6th of December, I was expecting to just take another sample back to the doctor for checking, but it was still cloudy. Again, the course of antibiotics had finished. It finished last Thursday, and of this ciprofloxacin, the cloudiness had come back again, and there was tiny blood clots again, not purple coloured wee, but a couple of little blood clots in there. So a different doctor this time, Dr. Stafford. He said he would have a word with he's got some urology friends, and he would ring back, and the sample was sent to the lab. Wednesday the 8th of December, I was rang by the urology department to tell me that the histology was good and there was no cancer. This was like 2 days after I found out, or 12 days after I'd already been told this by the GP. So they'd waited like 24 days to tell me. So saw Dr. Stafford, and he booked me to see the consultant. So on Friday the 10th of December, I was rang by the surgery to tell me that the sample was still positive, and I told them that I was booked in already to see the urologist next Tuesday. So, Tuesday the 14th of December, another appointment with the consultant at the hospital, and I told him it was still cloudy, and they tested it, yes, still had the infection. So this time he puts me on a 1-month course of trimethoprim, the same one he'd used before. Just one tablet, 100 milligrams per day. Now the 1-week course he gave me on the 22nd of September was 2 tablets of 200 a day of 200 milligrams. So 4 times the dose, but this time it was for a 1 month long. He was saying that it seemed to be a deep set infection, and we'll try a full month of doing it and then off it for a month, off the antibiotics for a month, and see if it remains clear. So again, during that month, during the first 2 days, it cleared up, went crystal clear. I'm on with this, still on with the prostate enlargement reduction drugs. The urine flow rate, the amount of going times per night, whatever, is much better. It's flowing better and everything. No pain or anything, but it is still this cloudy. So it says, do this 1 month of these trimethoprim and 1 month off them, and then come back and see me. So he made me an appointment for in 2 months' time, and again to have a blood test the week before that, which I did. So 2 months later, went back, knowing it was still infected. Like I said, for a month. I think it was about, I was on the antibiotics for a month where it remained clear. Then I came off. It used to sort of come back within like 2 or 3 days, or like 1 or 2 days, sorry. This time it seemed to be sort of 3 or 4 days before the cloudiness came back, but it did come back. So went back to see him on the 14th of February, and this time he puts me on a 3-month course. I said, well, just keep me on them forever. That was my advice to him. He says, just keep me on these antibiotics forever, because it's great when I'm on them. 3-month course of trimethoprim, then off it for 2 months, and then revisit him again. So that was booked for 5 months from that date. So that was the 14th of July this year, 2022. So I did that, stayed on these antibiotics for 3 months, 1 a day for 3 months, and then come off it, and I'm just sort of like, fingers crossed, please don't go cloudy, please don't go cloudy. Carried on weeing into this glass a week, 2 weeks, 3 weeks, great. It came to the end of the 2 months and it was still clear. I wasn't counting my chickens, but I've never gone that long, 2 months, with total clearness. So no symptoms. The prostate pills, what were they again? I forgot what they're called. The tamsulosin, the prostate ones, were working great. I'd had no more problems with hesitant flow or slow flow or anything. It was gushing out. I wouldn't say as hard as when I was as fast as when I was a teenager or anything, but it was gushing out no problem. I was going getting up maybe once during the night instead of 2 or 3 times. That was all great. And I'd gone a full 2 months after the course of antibiotics finished without any sign of cloudiness or anything. So again, tested the sample, and this time it was totally clear. So he said, I asked why did it take so long and so, to clear up, and all he could think of was, he said it just does this sometimes. He says it's quite rare. They'll usually clear up a lot quicker, but sometimes it's a really deep-seated infection, and you just have to give it a very, very long course to make sure you've got every single little thing. So that was it. Thursday the 14th of July this year, he said, I'm happy, I'm discharging you. So basically that is the end of the treatment. Now, one thing I did buy was these indicator strips. One step, I'll show them clearly in a minute, the ones I got from Amazon. And they're an indicator strip that you just dip in like they do it tested it in the hospital. You dip it in your urine and you take your reading, and there's all these, you could Google all what these things mean, but whenever it was cloudy, try and get that in focus. When it was cloudy, these top ones here, the leukocytes and the nitrite, they went really purple like that. You can see this side here, this is how it looks. This is how the strip is when you pull it out of the container. And if your that was dipped in your urine and everything was like that, everything would be clear. And then as it's detecting these things, they're moving up to this side of the scale. And there's all sorts on there. Leukocytes, nitrite, halogen, I don't know what. But it was these two here that were really purple. It was sort of like this colour and this colour when I had the infection, when it was showing cloudy. And when you clear, it stays these colours. As you can see on the actual tab itself there, you hold it against it there. And it's them top 2 squares. When they turn pinky purple, that's when I had the infection. So every now and then I dip it in. Even if I have a cloudy one, like I mentioned before, the odd cloudy wee is fine. It can be dehydration or whatever. I've even stuck it in there thinking, it's gone cloudy again. Have I got the infection? And no, I've been fine, shown no symptoms. So like I said, don't worry if it's clouded the odd time. But yeah, I found them quite handy and stick in. Sure enough, when I had after the antibiotics, when the infection kept coming back, I put that in, and it did indicate it went right bright purple. These are the ones I had Amazon. So they changed the label on the front now, just to be easier to read, I suppose. And they were quite good value. You get 100 strips for £7.59. So you can get yourself some of them. Like I say, it's home testing, so it might give you, you might think everything's clear and it's not picking anything up, so you're happy, but it can work the opposite way. But it gives me a bit of confidence that it's still infection free. So yeah, quite handy if you want to get yourself some of them. So hopefully it won't come back. It's been 3 months now. Throughout the whole of this treatment, it's never gone 3 months without going cloudy again, and it's been like 3 months or so since my last appointment, and it's stayed clear. Everything is flowing great, no pain, no signs of blood, no blood clots, no cloudiness. So like I said, fingers crossed, that is it. Now, like I said, so this started with signs of blood. Now, for me, that turned out to be a problem with the bladder, not the prostate, but it could be prostate, could also be kidneys. During all this examination, it was found I had an enlarged prostate, but not prostate cancer. So they've got me on these tamsulosin drugs. Now I have them now for the rest of my life. That's every day I've got to have that, along with it, blood pressure pills. So that's forever to keep the size of the prostate shrunk down, I suppose. But it could have been prostate cancer. It could have been bladder cancer. It could have been kidneys. And that's the thing I've tried to instill into this. As I said at the very beginning, and as I'm repeating again now, I'm making no excuses for, if you do have any signs of blood or pain where there wasn't pain before, burning sensation, anything like that, consistent cloudiness all the time, go and see a doctor. If it's nothing fantastic, if it's an infection like mine that'll clear up in a week, fantastic. It took a full year to knock my infection on the head, and finally it did, and that's all it was, just a very, very stubborn infection. Now, throughout all this time I've just seen on the timeline, the treatment by the NHS for me was fantastic. Every single appointment was kept. I had no cancellations. As soon as he said, I want to see you in 7 days, 7 days was when he saw me. See you in 2 months, 2 months was when he saw me. So I can't complain. Now, I know there have been a lot of people who are in trouble and their treatments have been postponed and postponed and postponed, but all I can say is the treatment I received from Blackpool Victoria Hospital was absolutely fantastic. So they are. I'm hoping this has been of some use. I know it's been boring for anybody used to my reviews or anything like that. I hope you sat and just watched it to the end, if at all interested, or if you've got any sort of similar symptoms. But hopefully it will be of some use, and if it makes one person go to the doctor early who wasn't going to go, great, it's done its job. So I shall catch you next time for probably another bog standard review on a tool or a gadget or something. Still got things in the pipeline, like I've got a drill to do, I've got a brake fluid tester I've just bought, still got the bike to do. All these will be coming along as soon as I get a chance to do them, and I will hopefully see you for them. Thanks for watching this one. Oh, and don't forget, I nearly forgot, if you want to subscribe, click the little picture here of the shed. Please give me a thumbs up if possible, and I'll catch you for that next review very, very soon. Bye for now.